SkyPeAnxietyCenter.com.
Well, thank you very much. I appreciate your prayers all that time. Yeah, it's starting to feel better. Yes, I can get around now, and things are good.
And your wife, too.
Yeah, what happened?
Well-
What happened with your wife exactly?
Well, she's not out of the woods yet. We've come up with some other problems that we're sorting through. She got appendicitis once I got home from the hospital, so it was emergency, rushed in, emergency surgery. Then she had complications. They let her out right away, like the same day, and came back, had medication issues, and just a whole series of things happened. She ended up back in the hospital a week later to try to correct what was going on. She finally got everything settled and was released again, and took another 2 weeks after that before she was feeling like her old self again. And unfortunately, during the exploratory work they did to discover the appendicitis, they came across a few other things that now she has to track down, and we're hoping that it's not serious, but there are some masses that they're trying to determine. So we have MRIs scheduled to get to the bottom of those. So, yeah, if you could keep her in your prayers as we move forward, that would be appreciated. Yeah, she's just not out of the woods. I'm doing good. Had my follow-up surgery a little while ago, or follow-up to my surgery, and everything is good. Got an excellent surgeon. He did a great job. In fact, all the nurses who were looking at the incision said, "Wow, I've never seen an incision that perfect." So it was pretty good.
That's great. That's awesome. Yeah, I can attest to that because I had partial knee replacement about a year ago, and if you're doing that great that soon, that's awesome. That's awesome. But they always say the hip is like the easiest, better out of all the two joints.
It is, yeah.
But I'm glad you're doing great. That's awesome.
Yeah, thanks. Yeah. It's
that appendicitis was a blessing in a way, because if they came across anything, they may not have ever come across it. It was worse, but the appendicitis brought all that to light. So
yeah, we're considering that absolutely. Mm-hmm.
Yeah, I will definitely keep her in her prayers. Absolutely.
Oh, thanks so much. Yeah.
And you've been through all this crap, Jim, and you're not hyperstimulated. There's hope.
Yeah.
Oh, you wouldn't believe all the things that we went through. I mean, that's just a few of the highlights. It's just the most bizarre couple of months I think we've ever experienced as a couple. So, but we're on the other side. So, yeah, do our best to keep calm and contain.
You're proof that what we're doing, the hard work we're doing, the miserable, you're proof that this recovery is possible. Recovery, not that I'm happy that you've been through hell in the last few months, but you're proof that, recovery is possible, which I think that's a miracle. I think it's beautiful.
Oh, well, that's an interesting take on it. Yeah, I never really thought of that. But yeah, it does work when you do your underlying factors. When challenges come your way, they just keep you in place. Yeah.
You're like Job.
Oh my. Well, it's definitely been challenging, I have to say. And thankfully we have family who was close by, came and rushed to our aid when we couldn't get around, because we were both in bed. We couldn't move. So family came and got us going again. So that was good too. So it actually brought our family closer together, which is also a good thing. So there's been blessings through that as well. And of course, God getting us through it is another big blessing. So now my challenge today is I don't know how long I can sit. I'm just right at that point in my recovery where, as the therapist said the other day, you can't do anything too long or your hip is going to let you know. So I'll go as long as I can. I may have to take a break and stand up and walk a little bit, but I try to answer everybody's questions today. So if you could be patient, that would be great. Okay. And it's also wonderful to chat with you all. You're kind of a family that we look forward to connecting with, so it's nice to see so many familiar faces, and hopefully you're all doing better. Well, but we'll find out in a minute. So typically what we do is just open the floor up for those who have questions or comments. And so we can begin. We are recording, so we can begin. Who would like to ask the first question? Or I see people are raising their hands. Why don't we do that as well? Teresa, you've raised your hand.
Hi, I'm really new to the channel. I listen to you guys all the time. I definitely know quite a few familiar voices that are on here today. So here is what's going on with me. It's going to be a five minute spiel, and I definitely would love feedback. I just got diagnosed with health anxiety, and it was from a trauma-induced situation about 2 years ago. I am dealing with hyperstimulation. My question is, and I know we're not talking about medical advice, but here is my situation. I have been to the doctors, the endocrinologist. I'm now going to functional doctors. I have been to the emergency room 3 or 4 times. I've had CAT scan, CT, blood work, you name it. And I guess I'm really kind of like, at what point do you have to really buy into the fact? Everybody keeps telling me it's anxiety. I mean, there is nothing wrong with me. Everything keeps coming back, but because I'm symptomatic and I have this like agitation and trembling, seems like all the time, and seem to have correlated it to a medical cause. I've been sleeping good, but the last couple of nights I haven't been sleeping. I still kind of suffer from on and off of vomiting. I just feel like anxious and on edge, which I've never felt before. I mean, I'm telling you, I have been worked up. I've done thyroid panels, blood work, hormone panels, metal toxicity. I mean, you name it. It's just, but when do you say enough is enough and then buy into the fact that it's anxiety and you got to roll with it? Because I think what's keeping my anxiety also alive is the fact that I'm compulsing, doing the behaviors that's keeping me in the loop, the checking, the doctor's appointments, the testing, all this kinds of stuff. And I just want to know, is anybody else have experience with that? And Jim, I know that you've had experience with hyperstimulation. I read some of your bio. It just starts in the morning. It does decrease in the afternoon and evening. And that's my only real symptom. It's just that it's kind of like internal tremor. Like tremor is not really internal. It's just that agitation and fidgetiness and can't sit still. And I seem to go like I feel emotionally unstable sometimes, and I go through these waves. It's beyond me. But like I said, I went through a bad trauma. I am working. The good news is the anxiety specialist I'm working with also does PTSD, and I've been doing EMDR on it, and my score went from 51 to a 19. So that makes me feel good. But the health anxiety and the symptoms, and she said, Teresa, you have an anxiety disorder. And it's just hard for me to buy into that because, again, I haven't dealt with it for 51 years. And I really landed myself in a pickle 2 years ago of some trauma. And it's been difficult. So I just want to know your feedback, and everybody else is in the group. Thanks for letting me share.
Well, thanks for that background. That's good information. It is common to go through all the medical tests and come up with a diagnosis of anxiety and to have all the symptoms you mentioned. So that is common. The only question I would ask is, did you ever have COVID?
I've never had COVID, and I didn't. I actually, excuse me. Let me go back and say, I did test for the antibodies, but it was back before 2020. So I had it when it was MERS or SARS, and I have not had COVID since. I didn't get the vaccination or nothing.
Okay. Alrighty.
So I don't know. And and here's the thing is I refuse to be put on medication for this.
Yeah. Yeah.
You know, I've never had depression, anxiety. It's been tough. It's been tough, and I don't know which way to go. So I'm kind of, should I just buy into it and just go all in, or what?
Did you ever do any of our online tests, like the hyperstimulation test or the anxiety disorder test?
Yes, and the hyperstimulation, I scored, I think, a 51, and then I think I scored like a 60-something, 63 the first time. And I think I scored like a 51 on the second one.
Okay. And how long ago was the trauma, sorry?
The trauma was about 2.5, 3 years ago. And it was from medical induced trauma, from being abused and by the medical system.
Mm.
So, I mean, they had me misdiagnosed. And like I said, I've never had any mental issues. And I had went through hormone replacement and it backfired on me. And they dumped a bunch of, SSRIs on me and then got me in the psychotropic cycle. And then they just completely cold turkeyed me on all that medication. And then they had me on benzos for a while, and I completely cold turkeyed off that. So it was almost like a snow globe effect in my brain.
Yeah,
So,
that's a lot.
My amygdala, my amygdala is like, my therapist goes, your brain is like a snow globe.
Yeah.
But the good news is I've been off of all the psych meds for 3 years. And 2 years coming up off the benzos in March or April. No, excuse me, May.
Okay. Yeah, you've been through a lot. Just making a note here. So since you've been off all of that, when you look back at the years that have followed, have you been hyper concerned about your symptoms lingering? Would you say you've been worrying about them and checking them and fussing about them and wondering what's causing them?
Absolutely. And the thing is it was by pattern, because I've never had health anxiety before. And when I was coming off the benzos I was literally on the phone with my friends from like morning, like we're talking 6 o'clock in the morning to like 8 o'clock in the evening. You think I'm going to be okay? You think I'm going to be all right? I mean, I went through rheumatoid arthritis. I went through fibromyalgia. I went through some kind of mitochondria craziness disease, Wilson's disease. I mean, you name it. I thought I had it.
Gotcha. Sure. Yeah.
But I will tell you this. My anxiety symptoms have decreased immensely. I mean, I'm getting better, and this just seems like it's just the lingering effect of it, but It's lasting the longer. But I think it's because, and I want your opinion on it, I think it's because I'm doing all the harmful behaviors, like the checking, the seeking, doing the more tests, getting involved in the internet, those kinds of things, unhealthy behaviors.
Yeah. Yeah, they'll certainly keep things going once they get going, that's for sure. I mean, based on everything you said, since you've had so much testing going on and you have that history, there's really a good chance that this is all hyperstimulation related from a lot of the components here, especially, coming off the meds too, can stir up the nervous system. And as you know from our materials, hyperstimulation just takes so long to recover from. It's just something that doesn't resolve quickly. And if we are concerned, that concern will just keep things moving because, that concern is stress. And so, again, based on everything you've said, I would say, it's probably hyperstimulation going on and you need more time. Can I ask, your rough age range
Yeah, I'm 54.
Okay.
I'm actually 3.5 years postmenopausal, and I didn't have any issues when I went through menopause or perimenopause, nothing. I was so oblivious to it. I didn't know what was really going on.
Yeah.
And I never had any problems with when I was my cycles or anything like that. I didn't have any anxiety or anything like that. I think, it's gotten to the point where it's almost obsessive because I've had I hope nobody laughs at me. I've had almost 8 thyroid panels done in probably 3 or 4 months.
Well, yeah.
And they're like, your numbers, this is what my endocrinologist said. Your numbers are not even good. They're optimal.
Yeah. Yeah.
So, and there's nothing wrong with my, they always say this cortisol thing, this is situation with the adrenal, I don't have a disease adrenal stuff, but I did the functional doctor that I did go to, we did a saliva test with a cortisol and she said, your cortisol is high. But she said, the good news is it's not flatlining. It is following a circadian rhythm, but it's just high. Yeah.
Yeah. And that would make sense. That kind of also falls in line with hyperstimulation and, with your age group, the body doesn't recover as fast as if you're in your 20s and 30s. So we have to be more patient as we get older because the body doesn't manage stress as well. So, based on everything you said, I'd say it's hyperstimulation. And if you could just say, you know what, this is hyperstimulation. Now I need to focus on getting my body stressed down and not worrying about this. I think you'll probably see faster progress.
Yeah, thank you so much.
Yeah, you're welcome. Yeah, and that's the thing, when hyperstimulation hits, especially when we get it into the upper ranges, it can be just a real, struggle to get it turned around to where we're feeling much better. And I'm sure a lot of the people on the call will agree. It's not something that happens fast, but it does happen over the course of time. So.
For sure.
Yeah, I was going to ask you, has anybody ever used like acupuncture as well?
Yeah,
I haven't, but Teresa, I wanted to tell you this, as far as not believing it's anxiety, I got into multiple screaming matches with my doctor because I did not believe this was anxiety.
Yeah,
so you're not alone in that.
I recognize your voice. Is this Marguerite?
Yeah.
And you know what, though? It's so bizarre because I literally broke down in tears and my endocrinologist said, I don't know what you're looking for. I just don't know what you're looking for. I have tested you. I've tested your adrenals. I've tested your thyroid. I said, this cannot be anxiety. There's just no way. It's so fit. I'm walking around like hyperstimulated like all the time with these emotional craziness.
Oh, yeah. And then just going to the doctor, like my doctor, I got into a full-on screaming match with him because he didn't want to check me for anything because he said I had anxiety. And I just have never wanted to hurt somebody so bad my whole life as I did that day. I just wanted to choke him out. But looking back, that was the best thing that could have happened to me because all that going to the doctors and the testing and the internet and going down the rabbit hole, that just was going to keep my anxiety going and just further entrench me.
Yeah, I've listened to your story. Actually, you really inspired me because I was listening to your hyperstimulation like in the morning and how it kind of stays, it kind of builds and then because that's how I do exactly. Like my thinking, I think, is what gets it going. But
absolutely. I had a rough day on Tuesday. When I say rough, nothing compared to what I had 2 years ago, but it was because I didn't gym. It was because I didn't stop and pause at the intersection, the decision intersection, and get off and exit off the fear trail.
Yeah, it's easy to do, isn't it? Just skip through that red light and away you go.
Yeah. I blew through the red light of the decision intersection and went down the fear trail and got myself, my symptoms kicked up a fuss, but nothing like what I was, nothing off the charts like 2 years ago when I was screwed to the ceiling with anxiety. Oh yeah, I argued with my doctor. I was like, I'm not an anxious person, And then Stacy had to put up with a lot of my sassy mouth too. So I even Jim Folk, I even told him, I said, buying into this is rough for me. But the sooner you do, the sooner you'll get better.
It is that's the whole thing. That's the whole hook of this, because I feel like when you're symptomatic, you think to yourself, or your brain, and that's what keeps this, for me, the cycle. I can't speak for anybody else. Because when my anxiety is high, is pretty much always there, the nervousness, it does go down and sometimes goes away. I have days where I don't have a day here and there that I don't have it and everything's good. But when I have the anxiety, I'm like sitting there, my brain will say, Teresa, there's no way this is anxiety. You've got to check. And I'll go on Google and I'll go down the rabbit hole of some other crazy endocrine system situation and, or heart situation. I don't really deal with the heart. The heart doesn't bother me, stuff like that. But it's just insane, and it hooks you and it keeps you in that particular pattern.
And Teresa, let me tell you this. I'm a registered nurse and I worked on some pretty hard floors. I'm pretty well educated. I'm far better educated than I'll ever use. And I had something that I needed to go to the doctor for a few weeks ago. Well, maybe a couple months ago. And Teresa, I don't look up any symptoms. When I go to the doctor's office, they print off whatever the doctor will print off about what my diagnosis is. That's all I have. I don't look up any symptoms, whatever, If I have a question about my med, the pharmacist has to print me off stuff. I don't go there anymore. I do not go at all. Even when I was still working at the hospital, if I had a question about a med or a diagnosis my patient had, I would look that up, and that's it. I made that vow to myself. I just don't scare myself anymore.
Yeah, that's interesting that you're a nurse. I'm actually a year from being a nurse. And then check this out. The surgeon that did my knee.
And the health anxiety is real common with people going through medical school and nursing school, because you're always around and you learn about the craziest diseases ever.
Well, the surgeon that actually did my knee here, we were talking, and he knows me pretty well, and he goes, "What's wrong with you? What's really going on?" And I started crying, and I told him, I said, "I have health anxiety." He sat down in the chair, and he said, "Teresa, so do I." Said it took me 2 years to get over fear of heart. He had a heart situation, but it took him 2 years to get over it. So, and then his assistant, his PA, that was helping me, because I got on this whole kick of being a titanium poisoning. I don't know what the hell is wrong with me, but and she told me, she said, I do not get on Google, Dr. Google, because it scares me. And she said, I went through a bout of health anxiety. So, this is a pretty common issue, especially in the health field.
Hey, Teresa.
Well, yeah, because you learn about all this crazy stuff, and you see all this crazy stuff.
Hey, Teresa. I don't want to interrupt anyone, but I just kind of wanted to tell you something. If maybe it might help you feel a little better. Yeah. My name's Brianna, by the way. Nice to meet you.
Hi, nice meeting you. I see you up there.
Okay. So when I first I started having problems with anxiety and stuff about almost a year ago. And when I started, I had about 56 different symptoms. And fast forward a year later, I'm down to only like 4 left. When I started a year ago, I had about 15 different fears that just played on repeat, like your health fear does. And I don't have any anymore, like at all. I mean, I had ridiculous fears too. I was afraid to sleep. I was afraid to take naps. I was afraid to be alone. If it makes you feel better, though, that stuff does go away. It really does just take a while. And you do get, you do become stronger over time. You really do. And what I started to do with my fears is face them. I was afraid to sleep, so I would just sleep. I would make myself sleep. And when I started, I would literally shake myself to sleep. I would tremble in fear. But the more I did it, the more I realized it's really not that scary. I mean, that's just an example. But the best way to address your fears, guys, is really just to face them head on. And the likelihood of you getting any of these diseases and I know logically you know this, but the likelihood of you getting any of those diseases, I mean, you have a better chance of getting struck by lightning than, So
that's funny that you said that. I know my endocrinologist goes, she's at the top of her field here where I live at, and I can't disclose that, the best in the region. And she said she made the top 50 in the country. And she's like, oh yeah. And bless her heart, I'm going to send her a basket of flowers. I have bugged the living bejesus out of this poor woman. And, she's answered all my questions, and she's like, no, there's no way you're hyperthyroidism. There's nothing going on. She's like, I would be out of business if I hadn't seen people with numbers like this. Mm-hmm. But, but the thing is, and I will tell you this, and I want to listen from now on. I've got to retrain my brain. Health anxiety from what I understand, and Jim maybe can back me up, is a subset of OCD. Mm-hmm. Whether I have it or not, that's not the issue. The issue is when I have that fear or the sensation of anxiety or adrenaline and cortisol, and my brain is telling me, oh, but just, what if they got it wrong?
You feel like you have no control over your brain or your thoughts, and there's nothing you can do about it. And I know exactly how that feels, 100%.
And I've got to train my brain. And I guess the more I sit with, not try to push it away, but say, yep, okay, whatever, and then keep on going with my day, apparently it just habituates, and your brain gets tired of throwing this fear at you, and then it goes away. That's what I'm understanding.
Yeah, well, that what you're doing there, what Jim's told me, because I had that same issue, and he said, well, what you're doing there is you're basically facing that fear. You're sitting with it and letting it do whatever it needs to do, and just being like, okay, well, really, what's the worst that can happen, you know? And then over time, your brain starts to kind of catch up, and your brain is like, oh wow, yeah, okay, this really isn't anything to worry about.
Well, I've been fighting this beast for about 9 months, so it's tough.
It is, but you can do it. You definitely can do it.
Can anybody hear me, please? I do not want to interrupt right now. I'm sorry, but Teresa, I have another tip for you because I went through the same thing.
Really?
Yeah, I'm a first-time caller. I'm from Greece. I hope everybody understands my English. I'm trying.
Greece, I can understand you. Go ahead.
Yeah, we can understand you.
Okay. But the thing is that I do not know if that's going to help you, but I think it's good for you to know, for somebody who contained that relatively quickly, if that's okay. A doctor told me, because I went through something similar regarding what you described. So one of the things that a doctor has told me is, whatever you have, if you worry about it, you're going to make it worse. That's kind of true if you think about it. Like, no matter what you think you have, and I know you know it deep in your heart that you don't have it, like that's the same with everyone, you know. But whatever it is, say, like, if you can to yourself, at least I could, because I'm a clinical dietitian as well, and like, anyway, I'm sorry, I'm trying to find the right words here, but the thing is that, like, if you do not worry about it, you're going to make it better, even if you have it or even if you do not have it. So I do not know if that's helpful, but it's just a tip.
You know, I appreciate all the comments and things. I would offer a slightly different approach. One thing is, you know, when you look at the fear response and worry, it is there for a purpose. It is there to try to protect us from harm. So we get these alarms that go off and say, what about this and what about this? And so we don't want to just ignore them as if, you know, we're not in any harm and pretend, because that's kind of a form of denial. And we could get ourselves inadvertently into trouble if we don't pay attention to what we think is a danger. So when it comes to health things, for example, we don't want to be ignoring all symptoms, because, you know, we could be leading ourselves into a place we don't want to get to. So we do want to respond to those alarms by, you know, for example, Tracy, you did the right thing by getting tests done. That's why we always recommend, if you got symptoms, whether new, returning, changing, or persistent, talk to your doctor about it, just to make sure, you know, they've checked everything out, and everything else it comes down to anxiety. And then when we've done that and we feel we've, you know, gone that route and got sufficient testing done, and there is a point where, you know, there's enough, because doctors will usually find things, and if you go for 2 and 3 opinions and all come back saying the same thing, you can be pretty confident that they got it right. But then where we have to stop ourselves is by running down the fear trail, as Margit was saying, by saying, all right, so let's look at the facts. Sure, all of us can come up with anything, you know, and things can change in a heartbeat. That's all true. We live in this world right now where there is destruction and illness and things like that. So we don't want to be trying to live in a utopia where we're just oblivious to all that or not paying attention. But we do want to be reasonable. So this is where, you know, Marilyn and I would deal with facts. Until we know facts, we're not going to do anything else. So what we do is, for example, the things that, you know, she's going through now, we'll do our research. She's medical as well. You know, talk to the doctors, make sure, you know, she's in the queue to get all these tests done that needs to get done. But in the meantime, deal with the facts. Right now, we don't have nothing. She has nothing going on. So deal with the facts. So whenever the mind starts to say, well, what about this? And what about this? And what about this? Because as worriers, we can come up with a million what-if scenarios, and they all can seem scary. So if we don't stop that what-ifing, we can worry ourselves into high hyperstimulation. So this is where dealing with facts is important. So if you've been through all the tests and your doctor say this is, you know, anxiety related, and it sounds like you have been sufficiently tested, now you have to say, okay, I have to stop now. I've got sufficient evidence to say there's nothing wrong, so I'm just going to stop here and focus on recovery. Because yes, worrying can make situations worse, But not worrying about a situation we should be concerned about can also make the medical condition worse. So we don't want to go to the other end of the spectrum. So we want to find that happy middle ground by paying attention to the alerts, doing whatever we have to do, and then when we get sufficient evidence, stop there and say, okay, dealing with the facts. And so this is one way that no matter what comes your way, because, the reality is as we get older, we're all going to be dealing with medical things. That's just how it is. The numbers and stats aren't really good as you get older. So it's got to be prepared for that. And so we want to be prepared.
I apologize for my bad advice, Ned. I'm sorry.
No, it's not bad advice. It's just.
Oh, no. I think it's like what my therapist said. It's living with uncertainty. But you're right, Jim, because the things that I think about and I've got one symptom. If I had any of these conditions I thought about, it would be more than one symptom.
Yeah.
And I'm confident. I went to my GP. I've been to specialists. This never used to happen. I mean, I went to the doctor on when I needed to go, and that was fine. I got caught in a loop and hyperstimulated, and that's the loop. And instead of living with uncertainty and allowing the thoughts to be there and go through, and eventually they'll habituate and go away, I keep them alive by digging, hunting, and pecking.
Yeah.
I will say this. I have one more appointment this afternoon. And after we have that conversation, I'm walking away from the medical field for a while. I mean, I just had my physical. I don't need anything else. I just got to walk away and give it to God and do the stuff that you guys talk about. Oh, by the way, I love the website. I tell everybody that's got anxiety, this is the most comprehensive. I mean, you can find everything that you're looking for under one site. That's great.
Oh, well, thank you so much. We have a lot more coming, especially level 2 stuff. So this is why I wanted to interject here, because it's so important that we do deal with reality in a way that's contained. Because again, when you look at going through medical things, for example, we can go through a large part of our life and not really be too medically sensitive because we haven't had anything that's really shaken our confidence. But when something really big comes along and our confidence is shaken, you see where the threat will set up. We become afraid because we just learned something that, wow, this can get really bad. I need to be careful. So when we come through something that's really traumatic, there is going to be an adjustment period where we have to dial things back a bit. So, based on what you've been through, it makes sense that you would be more health sensitive now than you were before. But you can also move through this by learning containment skills, dealing with the facts, not running down the fear trail. This is how we overcome anxiety for good, is by learning how to contain those worries. I know, been spending a lot of time on the various social platforms looking at all the advice that people are giving about anxiety. Two of the things that are hugely missing is the notions about hyperstimulation. That it takes so long to recover from. A lot of people say, well, just, my nervous system's dysregulated. If I do this breathing thing, I'm going to feel good. Well, when you're hyperstimulated in the moderate and above range, good luck. It's not going to happen. You can settle yourself for a moment or two, but because the body's so wired, it takes a lot of practice to get it turned down. And the second thing is the importance of managing, the uncertainty and the real risks. And we do that through how we allow our mind to dwell in those. It all comes down to mind, because when you look at anxiety, it starts in the brain, doesn't it? We perceive there's a threat. And if we continue to perceive a threat, we're going to continue to be anxious. So we control anxiety, how we think about things. And that's why we want to live realistically, but learn how to live realistically without worry.
Jim, do you have a video on just hyperstimulation explaining it? Because, just trying to explain hyperstimulation to people, I mean, that word just seems like it's a foreign word. They just, look.
We don't yet, but we are planning on doing a lot of video this year to explain these really difficult concepts, because we see a lot of people talking about various things and they're just missing the hyperstimulation part.
Yeah, definitely.
But the challenge again is that the amount of work that's required to turn it around, people don't realize how much it takes until you start working at it. And so I think, that's an area that is really important to focus on, but also more importantly, what we do with our thinking. How deliberate are we living? Where are my underlying factors? How am I going to change those so that I'm not always triggering myself? And I think that's a real huge piece that's missing. Sure, there's superficial, parts of cognitive therapy that work, But when you get right down to it, you got to go after those belief systems, and you have to make wholesale change there.
Jim, can I piggyback on what Teresa said and what you're just saying as well? This is Katrina. And I have
sure, you bet.
I have health anxiety too. And I totally agree with you. Like the level 2 recovery is where it's at, because, she was asking before about acupuncture, and I've tried it year after year after year. And I've had other issues with acupuncture that for me personally, sometimes it causes more stimulation. I don't think it's like you can do little things here and there and little gimmick things, like you're saying, this and that, whatever, and it's temporary. Really, the whole thing is you have to get to those core beliefs, those core issues. And for me, I have a problem with how to know when to check on physical things, because, with a doctor with health anxiety, I know you said before, like if it's persistent or new or reoccurring, but I feel like every little symptom, I overreact everything in my body, and it becomes more magnified than perhaps like the average person, or even someone who doesn't have health anxiety or just regular anxiety. And I also question doctors' opinions and their diagnoses, because of my health history. I've had wrong diagnoses, and I've had surprise diagnoses, cancer I didn't expect, and things like that. And now I'm dealing with they found a growth on my ovary, and I have to go back in 3 months. That whole waiting and watching and waiting and dealing with the anxiety from waiting, and I'm trying to contain. And I have a history of trauma, health, and watching others close to me suffer. And I know my core fears. I've been working with Doug since October 2020. He's been very helpful at Anxiety Center. I know I have a fear of death and suffering, fear of loss of control, fear of not being loved and accepted. And now I find that I'm obsessing over how to get over those fears. I'm thinking about it all the time. And so now, how do you not obsess over overcoming the fears? Like, it's constantly on my mind. I'm 51, going through perimenopause. I don't have a thyroid because of cancer, so my levels are always up and down. I'm also, sorry, it's a lot in one sentence here, I guess. I'm also seeing Liliana for the first time. I'm so excited on Thursday, or talking to her, I guess, on the phone. For nutritional counseling as well. So I'm trying to do all I can, but I guess my question is, how do you not obsess over the whole recovery process? It sounds nuts, but now, and just trying to, know that along with it.
I'm sorry, I didn't mean to cut you off. Yeah, I've obsessed over the recovery. Like, am I doing this right? Am I doing that? What do I need to be doing? And then I get obsessed about, like, almost OCD, like, about going online, thinking, looking at everybody else. Okay, they're doing it this way. Can they recover, faster than this? Or, I get like that too, and I get like that.
Can I just jump in there?
I think you're my twin, Katrina. Because that's me. That's me.
Yeah. Good, I'm not alone.
I would suggest, two things, especially about the medical anxiety. Find a good doctor. Find a doctor who understands stress and anxiety and hyperstimulation. And if you have symptoms that are unusual, talk with your knowledgeable doctor. But I also recommend don't go on Google because you can scare the life out of yourself, with something you don't have. But find a good doctor. A good doctor is one that will hear what you're saying. If there's a warrant, investigate whichever way it is, but also provide reassurance. That's the number one thing to help with health anxiety, other than doing the behavioral work.
The problem is, Jim, so many doctors, I'm in the United States, but so many doctors just go right to medication. My good doctor that I do trust for a lot, he's the first thing he'll say is, let me give you some Valium.
I know. Yeah,
that's
why it's hard finding a good doctor. Yes,
it is. It's a challenge. And obviously I'm using Doug as, he's not a doctor, but my counselor, but it's really tough. And I have a team because I have multiple health things going on at once, but I do trust like my endocrinologist, but then he'll be like, that's not my wheelhouse when I ask him things about other, perimenopause, right? So even though he's an endocrinologist, he'll be like, I don't know, ask your gynecologist. And then I have one that panics, but she's really good at finding things. So it's it's just really tough. So
if you got a good team, that's good. That will really help to settle you. But I agree, certainly don't go on Google. That's the worst thing a person can do. Find a good doctor, stick with that doctor, and listen to what the doctor says. The second thing is about recovery. Level 2 recovery is you got to be patient. You have to do one thing at a time. You can't be doing it all. You can't be rushing through behavioral change. I would suggest, working with a therapist who can identify those behaviors in order in terms of their importance and how they mix with others, then work on one issue at a time and take it slow and offer yourself lots of grace, making behavioral changes. Even though overcoming hyperstimulation is difficult and takes a lot of work, well, level 2 recovery is that and then some, because we're changing long-held beliefs. We're changing a lot of times how we view relationships, a lot of times how we view our career work and what we do. There's a lot of change that goes on, but the good news is that when we make that change, then we are stable for the rest of our lives. So take it a little bit at a time, work at a little piece at a time, give yourself lots of mental breaks. Sometimes say, okay, well, this week I'm not even going to think about level 2 recovery. I'm just going to live my life and give yourself a break and then come back to it again and pay attention. But take it really slow and be really patient with yourself. That's the only thing I can suggest.
Yeah, it's good advice, because when you get to that level 2 recovery, it is so intense. I mean, it's like, I don't want to say reliving your past, but it is in some ways. And because I've had so much trauma and so many people around me almost dying or going through horrible illnesses, like it's tough. And I have to constantly, as Doug tells me, look at the facts, examine the evidence, write it down, and try not to because I have a habit of putting myself in people's situations. I was an actress for years and a good actress. I was able to believe everything that I did, which is bad now. It's horrible now, because if I'll watch a program on television now, or a friend of mine or a family member is going through something, I put myself in their shoes and I live what they're going through. And it's like I go through their trauma, and it's really hard. And I have to learn how to separate that.
Yeah, and that is an after effect of trauma. We become super empathetic, and we become an emotional sponge of everybody else's. But this is where boundaries is really helpful. Knowing that, that's not my responsibility, and I feel bad for that person, but I've got my own things, and, they'll get through it if they get the right help. We have to distance ourselves at a certain perspective. It doesn't mean we have to be cold. Doesn't mean we don't have to be caring either, but we just don't wear their stuff as if it's our own.
Right.
Yeah.
I remember this part of my trauma. This is actually really sad. One of my a therapist that I was using for 2 years, and I kept telling her, I even brought in the workbook or the worksheet, and I printed off. I said, I have got this health anxiety, and I told her, I said, I think I'm suffering from trauma or PTSD. And she said, oh, no, you can just forget your past. You'll forget your past. You just got to put it behind you. Well, she was so frustrated with me. She wound up telling me, she goes, I think you're doing this to yourself.
Wow.
And she even told my husband that. And I was like, so I went to a friend of mine, a good friend that I've known for like almost 20 years. And I was crying on his couch. I said, what is going on with me? I said, so he did a 2-hour eval on me, and he said, you are suffering from panic attacks, PTSD, and health anxiety. And that has been straight across the board with everybody that I've talked to, all the therapists I've talked to, come up with the same identical diagnosis.
Yeah. Yeah. And that's the thing, when we come from a traumatic background, we see an important part of recovery, level 2 recovery, is looking at our past, not to relive it or not to blame other people, but to understand where those belief systems came from. Because we can only make change in belief systems when we understand where they came from, so that we can change them to what is a healthier view. So a lot of times we have to look at those situations with a distance view and say, okay, I can see what I did here, but that's probably not a healthy way of reacting. So this would be a healthy way of reacting. So I'm going to adopt this way. And that's what helps change those core beliefs, so that when we are facing future situations, our new beliefs kick in rather than the old ones. And I think until a person goes back and understands those connections, and if they don't address those core beliefs, you're still going to be struggling. You may have periods where you feel better, but it's not like a complete recovery. You'll always be going back and using those old behaviors. And that's why we're such a big proponents of doing the underlying factor stuff, making change there so that we can experience lasting success.
Jim, I have a question on that one, if that's okay. I'm sorry, everyone. And again, I apologize for what I said before. I'm really sorry. I did not know that was bad advice.
No apologies necessary. We all try to find ways to cope with fear.
Okay. So, yeah. But anyway, I just wanted to ask, how do we know we changed, though? Because, this is like my, 6th rebound. And I always went through level 1 and stopped, and level 1 and stopped. And I know I've seen on the website like pretty much that level 2 needs to be done. I came to a point where I know intellectually my underlying factors. I know I'm a perfectionist, a people pleaser, a warrior, a this and that. And I know I need to find like the beliefs, and I have like the same problem the previous person said, like where I obsess so much over how am I going to do everything right so I do not end up again in the same place.
Yeah.
So really, how do we know that because there's no behavioral change meter or belief change meter, if that makes sense, you know? So how do we know we've changed?
All right. Well, that's a good question. Lots of different ways. I can give you some examples. For example, boundaries was huge for me. I was a major people pleaser and an emotional sponge, as you mentioned earlier, Katrina. Just you buy into everybody's pain and you want to make it better because you come from a background that you saw it and you have a higher sense of justice.
You
totally.
want to
fix it, and everybody else, and especially the people who are causing the pain and the ones who are experiencing the pain. You want to fix all of that, and then you wear that emotion, stew about it for days and days. And so that's a behavior that creates a lot of stress and anxiety. So boundaries is really good. So how would a person know if you're, making headway with boundaries? Well, you can see the hurts and pains of others, and you can say, it's probably not a really good way of doing that, but you don't wear it anymore. You don't own it. You're not having these long conversations about what you would do differently or how you'd confront somebody, all that negative self-talk. You just don't do that anymore because you realize everybody's responsible for their own, hurts and sorrows and things. And I can't make that change. It's not my responsibility to change that person, not my responsibility to alleviate that hurt from someone else. And so when we realize we're doing that, then obviously we've made healthy change. People pleasing is another one. When we go into social situations, if we're finding that we're trying to win people by modifying our behavior so they'll be happy with us, well, then we haven't made change. But if we go into a social situation and we feel comfortable with who we are, no matter what someone else says about us, you've made change. And so you'll see the behaviors by paying attention to the areas that you're working in and how you respond differently. Another way to do it if you're working with a therapist is, I'm sure he's done a rating with you at the beginning. This is where you were, for example, we read on a scale of 0 to 100%. If we start off and those behaviors are right at 100%, and then maybe 6 months, 7 months later, we rate them again and they're down to 50%, you see we're making progress. So there's lots of different ways, but the biggest way is to realize how we respond to situations differently now doing the work than we did before we did the work. That's the greatest indicator.
Thank you so much. Thank you so much.
Oh, you're welcome.
Can I add something there? Something to that as well. So this is John here. I had really high hyperstimulation there 15 months ago, and it's a really apt time for me to join the Skype archives. I've been listening for a long time, but I just had a 3-day clear break there. And for me, that's just the strongest evidence you can have. It's like, for me personally, it just shows I've been following the program, and I made a commitment 4 months ago that I'll just commit to anxietycenter.com, because my biggest stress is not so much health anxiety. It's like, I knew I had anxiety, but it was like, is this biological or behavioral? And the biological route for me was like, this is something I have to live with forever, or I need to manage and control it. And I really rile myself up looking at other anxiety sites or places, and they say it's something that's manageable, it's genetic and all this, and that would just really stress me. But I just had to commit to just really having faith, not in a religious way, but just for me, just have faith, just trust this process. And right now for me, where I'm sitting chatting on this, I can tell you, like, I've just had 3 days that were really clear, and it's just made me remember what it's like to be before all this. Like, I went through trauma 15 months ago. I've been working on this 15 months. So just having that faith and committing to it every day, and it will come. So if it happened for me, and I doubted this so much, it can happen for everyone else. But but also another really powerful tool I found that I've been using for the last year is journaling. I used to spend half an hour every day journaling, and it's really good to capture the subjective ways that you can only capture, because anxiety is so unique and individualized. Just to write out how you're feeling, your physical sensations. So I can look back now 6 months ago how I was on any given day, and I have real strong evidence to see how much I've improved. So I really recommend it. And it's not just good in the sense of finding evidence. I just find it therapeutic, just to get my thoughts down. It's become a real friend of mine through this journey. Because again, other than people like yourselves on this site, no one else knows what it's like unless they've been through it. And you're kind of building a relationship with yourself, and you're talking about all your doubts. And I really find journaling a really powerful tool as well. So
it is good. Yeah. Another way too is keeping track of your core fears. Again, when you think of anxiety, we're afraid of something. And if you're working with one of our therapists, they'll rate your core fears. Scale of 0 to 100%. A lot of times you see your top fears, 98, 100, so on and so forth. So if you're working through level 2 recovery stuff and then you re-rate them and you're coming down like 40, 30 or whatever, you're doing a lot of work in that area. Because if you aren't afraid, you're not going to be anxious. Now, remember, there's two parts of anxiety. You have the behavior that stresses the body. And then you've got part 2, which is the physical consequences of that behavior. We don't want to mix them up and say, well, I'm feeling anxious, therefore I am anxious, because that can just be hyperstimulation. So you want to look at our thinking. But if we're doing our work and level 2 recovery is coming along, and as you mentioned there too, as we're bringing that down and we're seeing we're getting cloudy breaks, the body's recovering, and we're paying attention to our behaviors and our core fears are coming down, that's really good evidence that the work we're doing is starting to pay off. And eventually, we should get to that place, because typically, if we're rating people who don't have anxiety, they'll rate anywhere from 0 to 30 on a scale, and 30 being at the top end. So if we're, doing re-rates and so on and so forth, and we're down in the, 15 to 20%, we've done a lot of good work. And that is going to show up in terms of how we interact with others, how we're feeling. Do we have to do stress decompression every day anymore? A lot of times when a person recovers, they just live their life and they forget about all the recovery strategies because they don't need them. And there's another good indication that we're making progress. So there's lots of little ways to recognize we're making progress, but I really highly recommend tracking those core fears, tracking the behaviors and re-rating them on a regular basis. Because a lot of times we can, it's like an onion. When you peel off the onion, there's a lot of different pieces, but as you're starting to work at your underlying factors, some things might start to surface where others have started to diminish. Re-rating is a really great way to see where the work is required and to keep us on track. And again, we don't want to be doing it obsessively. Like, it's not that we want to approach life this way. Well, I can't live my normal life until I'm completely done with anxiety, because that's the wrong way to approach it. We want to live our lives as normally as we can as we're working at our underlying factors, recognizing that over the course of time, our life is going to get easier, less anxious, less stressed, and over the course of time, things will unfold naturally.